Alright, so Casey and I have came up with a game plan. We're going to talk about that. What we decided we're going to be doing is filling in exactly what we did before, but a little bit more of a condensed version. We're going to go through, tighten up the hairline with more micrografts, fill in the temples, blend into the existing hairs which we've already grafted from the previous surgery, and then just basically reframe them the entire way around. Now, one of the things Casey wanted to talk about was whether or not I was gonna take the previous donor scar out, or whether we were going to go into a new area. And the way that works is, if we take the old scar out, we can and leave you with one scar. The problem is, or the challenge is it just limits the amount of hair we get for the patient. So we can't guarantee how the elasticity is on a second procedure. So if the patient's focused on hair, we always recommend to go do a second line to maximize the amount of hair we get. Now, there's not a right or wrong answer. It's a matter of what the patient wants to do. But how I guide the patients is I like to get hair. And because he had an FUE previously, when you take out an old scar and an FUE, it's obviously going to limit the overall amount of hair I'm going to get for him on the procedure. And so what we decided to do was go into a new area. So we're going to show you what the game plan is with that. So we have the area shaved, so we're taking them all the way around. Now, here's another option, a chance for you to see these little FUEs here. Back up and zoom in? No? Okay. So, and then all the way around. Okay, so that's our game plan. So we're just going to maximize the donor hair, fill them in, and put them back in business. Now, one of the things Josh had just mentioned is taking it to the next level. And what were you saying, Josh, about it?
Well, it's really interesting to see that in the 1 year since Casey's been here, he was really down when he first came in a year ago. He had a horrible experience, which we hate to see anybody have. And he came as a last-ditch effort for Dr. Bolton to give him a result like he sees on our website. And he was skeptical. He's like, well, I hope I could get that result, but since I was promised something equally before, I'm not so sure that's going to happen. And he said, if it works, great. If not, I shave my head and I call it a day. So that was 1 year ago, and he turned around, man, in one time. Now we're looking for perfection. The second procedure, we're going from a young guy, 22 years old, who's going bald, to now a guy, 23, 24, who's going to get all his hair back. Full, thick, low hairline, built-out temples, wearing a hairstyle without doing any creative comb-overs. I mean, look at him smile, man. It's really so. This is, like Dr. Bolton says, this is what it's about for us. We really believe that we do more for our patients, we care more, and we have a highly skilled doctor, 20 years experience. People don't understand that. When you have a high-level doctor, 20 years experience, you can't go to a doctor who's been doing this 2-3 years and has no photos on his website. What are you guys thinking out there? Come on. Give a guy experience in his trade. You can't go to college and get out and 2 years later do its own, who's operating at a high level for 20 years. So I respect Dr. Bolton. I see what he does every day, and I hope you guys focus on what's most important, which is the individual doctor's work, his experience, and his catalog of work is second to none. And that's how you guys should help make your decision on a doctor who's proven in his field, regarded as an expert, and has a body of work that's incomparable.
Well said.
Yeah, he can't do that. It's great form.
Let's get you some hair.
All right, let's do it.